A lot of people are getting sort of sticker shock here, and doesn't Republican Senator John Barrasso know it? Of course, he has been one of the early people calling for just repealing this thing, starting from scratch. But obviously now, as you know, Senator, we got millions knee-deep in this, and now digging in deeper to their pockets to pay for it. These are double-digit increases for the same type of coverage. And that was not how this was built. First, let's talk about what happened and why. And secondly, what you're going to do about it. First, what happened? Why are these premiums seeing such a big jump?
Well, because the president really, I think, didn't have a full understanding of the impact of his law on people all across the country. He made people buy insurance by his mandates. That is so many different things on the laundry list that they have to buy that it, of course, was going to drive up the cost. You know what I want to do? I want to find people, make sure more people get better care at better costs. We don't have that. You know, Neil, just yesterday, the Michigan co-op failed. Now more than half of the co-ops have failed, and you have over 800,000 people who had their insurance through Obamacare through the co-ops. Now all of them are scrambling to try to find new insurance. But you're right, when the president said, if you like what you have, you can keep it, now he's saying that no longer applies. You better shop around, because the only way you're going to find any insurance that you might be able to afford is if you get rid of what you had last year and try for something different this year.
But it's more than that, right? I mean, now I think that some of your Democratic colleagues, not all, are saying you have the drug companies really contributing to this because they've been gouging Medicare, Medicaid on these drug prices. And that's what's being reflected in these prices. I don't believe that's the case here. That's a separate issue. But update me on that and using that to shift attention away from how costly this whole plan has become.
Well, you're absolutely right, Neil. They're trying to shift attention away from this. And, you know, most of the people that were covered under this new health care law got it by getting onto Medicaid, a program that, because it pays hospitals and doctors so little, it's a lot harder for those people to actually get care. The president focused on the word coverage, but I focus as a doctor on the word care, actually getting people health care. And now, you know, you have a government product here. I mean, it's interesting. The government is going to pay you to buy it, and they're going to penalize you if you don't buy it, and people are still not buying it because they realize for them individually it's not a good deal.
And bottom line, I mean, it's not extracting I'm sorry, as a doctor, you know this better than anyone, that it's not extracting the savings that we would have thought. If anything, it's adding to those costs. So I'm just wondering now, is the Republican position, I know yours is get rid of this thing and all, but then what do you do for the 8 million or so who apparently are covered now? Do you carry them on a temporary policy until Republicans, presumably you hope, I guess, with a Republican president, start from scratch, or what?
Well, it's been my position all the way through that this should be state health care choice, and I've introduced legislation like that. So if California and New York want to keep what they have, fine. But if Wyoming and Texas say, no, we don't want the mandates, we don't want the employer mandate, we don't want the individual mandate, we don't want to have to buy this entire basket of insurance that the president says we need, let Wyoming families decide what works best for them, that fits into their budgets and the insurance that they need for their families. I think people at home are much better able to make those decisions. But you had the governor's race in Kentucky yesterday, where the Republican candidate who was against the Obamacare program won overwhelmingly against a candidate on the Democrat side who's embraced it. So the president says it's working a lot better than he expected. I mean, I don't know what he expected, but this has been a terrible failure, and I believe is actually heading into a death spiral as fewer and fewer people buy because the costs are going higher and higher.
Well, to your point, there's no doubt that more people have signed up. The fact of the matter is, though, that more people are paying more for those who have. But, Senator, thank you very, very much. Very good seeing you again.
Thanks, Neil.